on early 2021, this what happens in Johor. At least 3 people have been killed, with more than 30,000 of the population is affected due to the severe flood. Flood is the most prevalent hazard of the natural events causing disaster. It usually happens in developing regions with high buildings as well as a skyscraper.
In Malaysia itself, there's 2 types of flood, including flash flood and monsoonal flood. Flash flood happens unexpectedly, but only lasts for a few hours. As for monsoonal floods, they are predictable and yet can last for months.
Meanwhile, in Sarawak, the most prone area to get flood is Sepanjang, as well as Syrian. This occurs due to the height of the land above the sea level, and also due to the poor drainage results from the obstruction by the clogged drains with rubbish and overgrown weeds. So, why flood is important to us?
Well, flood causing destruction of infrastructures, enormous economic losses public health, and eventually death.
Besides, it creates a conducive environment for disease transmission, especially from the rodents like rats, causing leptospirosis.
Other than that, the high levels of rainfall could potentially increase the dengue mosquito numbers and results in disease outbreaks.
Dengue virus is not transmitted from a person to another. Only infected mosquitoes can transmit the dengue virus. As you can see from the picture, when a mosquito bites an infected person, it can spread the virus to a healthy person. And it can be infective for the rest of its life and can spread the virus every time it bites someone. When you are infected with dengue, you may show some symptoms that can give you an idea that you are having dengue fever. Some of it are sudden high fever, severe headaches, nausea and vomiting, pain behind the eyes, skin rash, sometimes bleeding from the nose. Rodents are the most common animal that can cause leptospirosis. As you can see on the left side of the picture here, it shows how the bacteria is being transmitted to human. One of it is when an infected rodent bites a person. Number 2 is if you have a scratch or a cut on your skin and then you have a direct contact with the urine of infected animal or its feces, you can also get leptospirosis. Another way that you can get infected with leptospirosis is when the urine or contaminated water gets into your eyes, nose or mouth. The bacteria survive longer in a warm and humid environment. Therefore, the disease is very prevalent during flood season. If you're having symptoms like headache, high fever, muscle pain, or red eyes during flood season, please go to the nearest clinic to get treatment.
Okay, good afternoon, Miss. So we are third year medical student from Unima. So today we are going to have some interview with you. Is it okay? Okay, can you please first introduce yourself?
Okay, my name is Sakina. I'm from Sepanjang. My name is Sepanjang and I'm 23 years old. I'm come from Cebu, Sarawak.
My name is Lukman. I'm 22 years old and I'm from Kota Baru, Kelantan.
May I know, have you ever experienced flood before? Yes.
Okay, can you share a bit of your experience?
So I experienced flood 3 times on June, July and November last year. So it is due to heavy rain for a few days, and then the dam also burst, and then we didn't expect the flood as the flood comes after the rain stopped.
Okay. Do you know anything about diseases due to flood?
Yes, I do. For example, is leptospirosis, food poisoning, and cholera.
Do you know why it is very common for it to occur during flood season?
After the flood, there will be stagnant water, and it will become the breeding site for the mosquito. And for food poisoning, flood water is a contaminated water, so people usually will use it to wash their food and also their utensils.
Do you know why these diseases are common during flood?
Yes, because of the contaminated water and food, and then due to the electrical cut off, cause the food turns bad.
So can you share the sign of symptom of the disease?
for dengue, and dengue can presented with high grade fever, and then for lepto usually presented with muscle pain like cough pain, and food poisoning, stomach ache, vomiting, diarrhea.
So, what kind of practice do you usually do to prevent from getting the disease?
In order to prevent dengue, usually I will wear the long sleeve shirt, especially after sunset. And for food poisoning, I will try to use the clean water to wash my vegetables and also my utensils.
Normally, you and your family, where would you get clean water from?
For drinking, my family members prefer the bottled water from the shop, and also for daily purpose, we will try to use the filtered water.
We usually wash our hand regularly, and then we always reboil water before drinking, and then we throw away all the food in the refrigerator.
Yes, I do wear a long sleeve during midnight, and then I also wearing both during working in the flat, and then I practice good hygiene, like clean the hand before and after enter the toilet.
Do you think it is important for people to know about this?
Yes.
Yes, I think it's very important. When people have the knowledge about the disease that can be caused by the flood, they will know how they can do to prevent the disease.
Yeah, I think it is important, as if people are aware of these diseases, then if they have like symptoms, they can present it early to seek for medical attention, and then if they know how to prevent it, then they can prevent it earlier.
Okay, that's all, Miss. Thank you.